The major reason for failing the OSCE exam in Australia is the inability of the candidates to understand the practice standard differences between India and Australia. So the first and foremost difference is the evidence-based practice. Here in Australia, the nursing practice is guided by evidence-based data. So recent researchers and safety learning system data are reviewed every yearly, and new procedures, policies and protocols are made up, and the nurses are following these reviewed policies and procedures. That makes the major differences in the Australian nursing practice, and the nurses are using critical thinking while giving patient care. The nurse should be able to identify, for example, identify the side effects of an IV morphine injection like respiratory depression, shallow respiration, and decreased response from the patient side, and should be able to withhold the medication even if prescribed as IV morphine 4-hourly. So that sorts of critical thinking capabilities should be required for a nurse who is working in Australia. Here in Australia, the nursing practice is guided by national safety and quality in healthcare standards. So these NSQHS standards are strictly followed by every nurse who is practicing nursing in Australia. And here the nurses has a great autonomy in their practice. Through their assessment, if they are identifying the patient is going into a clinical deterioration, even without taking the time to inform the particular consultant who is treating the patient, she is free to initiate a medical review from her side. So that is the span of autonomy which is given to the nurses in Australia when they practice nursing. Next, the patient, she is working as a team member of a multidisciplinary team. So being a part of a multidisciplinary team, her communication levels should be competent. So you need to work on your communication levels when you give OSCE exam, because in the OSCE exam you are not only assessed for that particular skill, you are assessed how your communication levels are, how you are looking for the safety procedures in your patient, how you are making your patient comfortable, what all are the infection prevention activities you are practicing, and how you are identifying the problems in your patient and critically managing these things and preventing the development of complications, how you are providing an ethically framed nursing care based on Australian nursing standards are being assessed. So prepare well for your exam.